I will now hand over to Patricia for her questions from a caregiver's perspective. So over to you, Pat.
Thank you very much for having me today. I'd like to begin with just a little bit about my father, who was an ordained United Methodist minister in his prime at age 46 when he was diagnosed with organic brain disease, they called it, back in 1960. His particular problem turned out to be frontotemporal, of course, problems with judgment and problems with inhibitions. And that meant that he was treated mostly with psychotropic drugs to control his behavior. And he was in and out of private and state-run psychiatric hospitals for many years. My question for Dr. Grossman, I think you answered it earlier by saying that the name of the game is to block that tau protein. But are there any medications available now to delay the advancement of FTD?
Right now, there are unfortunately no medications that are available that will slow the progressive accumulation of these misfolded proteins that can affect the frontal part of the brain and can cause the difficulties with judgment and control of behaviors that you described in your father. There are now better symptomatic medications that are available that can help with management, so that there are fewer side effects, and the treatment strategies seem to be more effective now than they were at the time when your father was first diagnosed with FTD.
Well, that's certainly good news for others. My next questions are addressed to Dr. Wolk. My mother had a condition called atrial fibrillation, and she was on a blood thinner for years before she developed dementia with Alzheimer's specifications. Is atrial fib another risk factor for developing dementia?
Thanks, Pat, for asking the question. So atrial fibrillation's where there's a sort of funny rhythm in the heart that can cause the heart to get, the atria of the heart to get somewhat less, that they have sort of less movement, which makes it more likely for clot to form in the heart, which can then cause strokes. And so untreated atrial fibrillation, certainly if it causes strokes, can cause cognitive impairment, which ultimately can result in dementia. Because dementia can be caused by, essentially any kind of brain injury that affects thinking to the point where people's function is impacted. That being said, treated atrial fibrillation on a blood thinner doesn't tend to be a significant risk factor for dementia, and there's no particular link between atrial fibrillation and Alzheimer's disease.
Thank you. My mother also had a condition called pernicious anemia, causing her to need frequent injections of B12. My brother and I now both have this condition, and we're getting the same injections, and I also take a daily prescription of B12 in tablet form. I understand we may both be at higher risk of developing dementia due to this deficiency. Do you have any other recommendations?
So I think, one, I'm glad that it was discovered in you also. You knew that you had this and it can be treated, and it sounds like you're being treated the correct way. When Dr. Grossman was sort of talking about the basic approach to how we diagnose patients with dementia and with cognitive impairment, one of the things that we do is we look for other causes of cognitive impairment that can be related to other medical conditions. And one of them is actually having a low B12 level, which can be associated with injury to the brain and to some extent to the spinal cord and can cause cognitive impairment. The reality is, though, that just like atrial fibrillation, if B12 is treated, if you're given back B12 through injections or very high doses of oral B12, like what you're taking, there really isn't a significant risk of developing dementia. Really, once you're doing what you're doing, you're actually allowing your B12 levels to be normal in your body and allowing B12 to do what it does to keep it from causing these cognitive symptoms. So I would say you're at no increased risk as long as you continue to treat yourself appropriately for the B12 deficiency.
That's good news. Thank you.
Yeah,
I have
sure it is.
two other questions. What role does hearing loss play in causing dementia?
Yeah, I think that's a fascinating question because I would say the answer is not completely clear, and there are people who are studying the effects of sensory loss, visual and hearing, and how that impacts the brain changes that occur with dementia and even with Alzheimer's disease. There's no doubt that having poor hearing or poor sight can impact your thinking because it causes you to be more distracted when you're trying to listen to what someone's saying. So if you're having trouble hearing what someone's saying, you're kind of focused on really trying to discern the words that they're saying as opposed to really thinking about it deeply in the way that we often do, and that then impacts your ability to later remember that particular thing. And so in that sense, it kind of exacerbates any issues that you're having with your thinking in the first place. And actually, it's one of the things that we often recommend of our patients if they have changes in their vision or hearing. We really push them to try hearing aids or other things because that can lessen the degree of cognitive impairment that might be driven by something else in addition. But I think there also is some argument that there may be some sort of feedback between some degree of sensory deprivation with aging that can also, in a more direct way, result in cognitive decline. But I would say that's an area of kind of fertile research right now.
Thank you very much, Dr. Wolk and Dr. Grossman.